Cervical cancer affects between 17% to 29% of women in India. More than 160 million women between 30 to 59 are at a risk of developing this fatal disease. More than 1 lakh new cases are reported each year. But cervical cancer is preventable. Regular, low-cost, community-centric screening for early detection drastically reduces the physical, emotional, and financial burden of cervical cancer. Early detection saves women. It saves families. It reduces the enormous burden of late detection on tertiary care centers. The GynaeCam is an IARC protocol compliant, a non-invasive, internet-enabled imaging device that is capable of recording and transferring data securely from community screenings to gynecological oncologists at nodal medical centers. GynaeCam allows women to be screened in their own communities. This avoids expensive medical travel for women and the discomfort of repeated invasive screening. And not just cervical cancer, the GynaeCam can be used in the detection of other diseases too.
But we never thought of having such any of the tool in our hospitals because of the cost factor. You spend lakhs and lakhs of rupees for very few patients that come to your OPD. But if you have such beautiful tool that is very handy, our instrument will be very useful in seeing. Number 1 is cervix, number 2 is vagina, and number 3 is what is coming through cervix. Understand that the cervix is there, whether it is normal or not. Now, regarding this particular image, we can come to know that whether the cervix is at its proper level or it has descended down till the edges of vagina. So the diagnosis of prolapse can also be made. Then regarding, yes, any mass is there, any erosion is there over the cervix, any discharge if it is there, whether it is infective or non-infective, we can judge according to the color of the discharge that is visible in the photograph.
Acetocyte areas are the places from which we take biopsy.
Okay.
These are the findings positive for likelihood of cancer.
Through this examination, it is not only about cervix, it is about vagina as well. So, if any abnormal things are there in the vagina, in the form of atrophied mucosa, some spots or dots in the vagina, some infective material in the vagina, that can also be identified through this particular instrument.
With the GynaeCam, we can bring telepathology-enabled early detection protocols to the most remote, underserved areas of the country. Let us aim for better health and a better life together.